Um, Now, I always say that the eyes are the window to the body. We can tell so much about a pet's general health just by getting a sense of what the eyes normally look like and, of course, any departures from that. So I look to make sure that both eyes are symmetric, that the eyelids are open, and the size of the opening is consistent from one side to the other. You don't want to see any drooping or any spasming of the eye, suggesting pain or any excessive discharge. Get used to knowing what your dog's white of the eyes look like. It should be white. It shouldn't be injected. Anytime your dog's eye is red, that's an indication for intervention. The cornea is the clear part. That's the part that you look through to see the actual iris or pupil. In good lighting, you should not be able to see other than the reflection off of the cornea. If you're seeing anything on that normally transparent layer that interferes with your ability to see the iris, that could be an abnormal finding, or it could be your pet's normal. So get used to knowing what that is. Looking through that cornea into the pupil, you should see a normal symmetric pupil size. If there's a difference in pupil size, that could be a concern. If you're not sure if your pet is seeing, you can do something called a menace test, where basically you just put your hand and just wave it in front of your eye and your pet should blink. That's normal. If you're not sure, try the other side. If there's asymmetry, that would give you an indication that one of the eyes may not be working properly. All right. Lastly, make sure you put your hands gently over the top of their eyes to see if there's any evidence of asymmetry in the eye. You can gently push, not too hard, because if it hurts, you don't want them to feel that. The eye is essentially like a three-room apartment. You have the outside layer, which is the cornea. Then beneath that, between the iris and the cornea, is what we call the anterior chamber. Behind that is the posterior chamber, where you have the lens where cataracts form, and then the very back portion of the eye is what we call the retina, which is essentially the film, the recording sensor of the visual mechanism. So when we look with an ophthalmoscope, we're looking through all of those layers successively through a variety of different lenses, focusing on different focal planes to see where the pathology could be. The reflective surface of the retina has different pigmentation in animals and people. People's actually do light up, but they don't have a structure called the tapetum, which is a reflective coating on the inner layer of the upper part of the retina. Actually, that's an older age change in the lens where the fiber becomes less resilient and becomes less translucent. And that tends to reflect light in the back of the eye. And if you looked at Addie's eye, she's about 10 now, she's getting there too. And then we use that many times to age a pet, so we can tell if they're getting older. If you do see an asymmetry in the color of that, where one may be bluish and the other one could be white or grayish, that could indicate that you have a cataract developing as well. I don't worry about that bluing. The bluing is actually called lenticular sclerosis. We get that too. It means that the lens is not as accommodating. It doesn't tend to resist, or it tends to be more resistant to stretch, which means it doesn't focus well, which is why we wear glasses. The dogs are accommodated really more for distance vision. Their close-up vision doesn't work very well, so I wouldn't say that they're having trouble doing close-up work like reading the New York Times, or they're more adapted for distance. So it's not anything that requires treatment. If there is a cataract, however, that would something that should be closely watched. There are certain medical conditions that can predispose to cataracts. Congenital ones are commonly injury, but also diabetes. But that usually doesn't happen until the pet starts therapy.